I'd like to thank Gulf Coast Institute for hosting this educational video regarding our new Falcon Xpress system. We've designed this system with all of the vascular sonographers, independent labs, internal medicine, podiatry, cardiology in mind. This system has all the diagnostic capability that our Falcon Pro does in a small package, and it's actually a more economical package so we can meet all of those markets. Well, there may be a few bells and whistles that aren't in this that are in our Falcon Pro. For the most part, it is the same system. If you know how to work a Falcon Pro, or Falcon Quad, or even a Dolphin system, you'll know how to run this Falcon quite quickly. The Xpress is nice, very easy to use, and an economical package for you. Full reporting capability with complete connectivity. So we look forward to serving you, and we look forward to presenting the new Falcon Xpress system. You're going to love it. Thank you.
Hi, I'm Tricia. Welcome to today's demonstration of the Falcon Xpress Vascular Testing System by Image Monitoring USA. In today's demonstration, we're going to walk you through some of the exams you can perform utilizing the Falcon Xpress system. Those are going to include the brachial Doppler pressures, the ankle PVR waveforms, the Doppler waveforms at the posterior tibial and dorsalis pedis arteries, the ankle systolic pressures, the toe PPG waveforms, and the toe systolic pressures. So let's get started. All right, so the first thing we're going to start off with is going ahead and applying our cuffs so that we can perform our brachial and ankle pressures. So it's really important that the cuff width is in relationship to the girth of the arm and the ankle. So we can just take the cuff and just simply lay it on top of the arm. And as you can see, the cuff is basically the same width as the arm. If it's much larger or smaller, then we would need to adjust our cuff size. So on my model here today, the 12 is just a little bit too big. You can see I have a lot of overlap. So let's compare and see what a 10 would look like. So we'll grab this cuff and we'll compare. And as you can see, that's a much better fit. Having too big of a cuff or a cuff that's improperly wrapped is going to create some artifactual information in our overall readout. So we want to make sure we're using the proper size cuff and wrapping it completely and tightly so that we can get the most accurate information. So let's go ahead and apply the cuff. We're going to open our cuff up. It doesn't matter if the hose is up or down. We do want to make sure we go high enough on the arm and that there's not any clothing or any bulky material over the patient's arm. So if they have a sweater, you're going to want to have them remove that. With their t-shirt, just go ahead and just push it up. We're going to make sure we wrap above the level of the elbow. We don't want the cuff falling onto the bony elbow. So we're going to start relatively high. And we're just basically going to wrap underneath the patient's arm, bringing that cuff up and over, allowing the Velcro to touch and creating a nice, smooth cuff wrap. So that's how we do that brachial cuff. Okay, so we're going to move on to the ankle now. Again, we want to take our cuff. We want to check the width of our cuff, make sure that it seems to be appropriately sized. Again, I'm going to go ahead and use that 10 cuff on this patient. However, if you have a patient with a lot of edema, you would want to upsize your cuff to allow for that because we want, again, for it to be in relationship to the width of the patient's ankle. We want to go about 2 fingers above the level of the bone, the medial malleolus here. So make sure you're measuring about 2 fingers up, and that's where you're going to place your cuff. Now the patient's going to want to help you because they're always so kind to us and like to assist us, but it is important that their legs stay completely relaxed. So I'm just going to say to my patient, I'm just going to have you completely relax your leg, keep it nice and relaxed. You're going to feel me lift it up as I wrap this cuff. And that'll make sure that this muscle stays nice and relaxed so it doesn't cause any sort of loosening of our cuff when we lay the leg down. So we're just going to lift the patient's leg, wrap that cuff underneath, hold it in place, pull snug, and then wrap over the top. Again, it's really important we get a nice snug cuff fit so that we can get the appropriate and accurate information. If you have a patient with a lot of edema, sometimes it is helpful so that you don't get that oscillating going on during the cuff inflation to just take your patient's leg, lift up, place a towel underneath, and that'll give that cuff some room where it doesn't have that pressure from the bed pushing on it. All right, so we've got our patient all wrapped and ready to go. Before we get started with the first part of our demonstration, I would like to introduce you to Staten Hoover. He's with Image Monitoring USA, and you're going to hear him kind of interjecting some additional information as I go through some of the tests today because he is the expert. He is the one who will be there to support you and kind of walk you through, him and his team. So he's going to give a little bit of that background information that helps people like me who are performing these tests do it at our very best. Thanks for being here.
Thank you.
Yeah. Okay, so we're going to start out by putting our patient into the system. So we're going to hit New Patient. That's going to open up the patient details page, and we can go ahead and start entering our patient ID number. Now, if your patient has been here before, he should automatically populate as you see has happened here. So I have my patient information. Additionally, I can add in the referring or primary care doctor who's requested the exam, as well as the staff or technical person who has performed the exam. We can put them underneath examiner. After that, I do feel it's very important to put a little bit of the medical history in. This will help with both a more complete picture of what's going on with your patient, as well as for billing purposes. You want to have as complete of a picture as you can so that you can get the full reimbursement for your test. So let's go into our medical history page. Here you can add their height, their weight. You can do any risk factors that they have. You can also type in any indications that you want to list out. Additionally, you can push indications over here to the right, and you can actually go in and put in current symptoms or any diagnosis codes that were associated with the order. Again, super helpful for your billing component. Once we're done there, we're just going to say OK and hit OK again to get out of all of this, and now our patient is ready to go. As you can see, I do have Seabass laying here, my model, nice and comfortable. I do like to have them lay here prepped, ready to go with the cuffs on for a couple minutes, at least 5 minutes, so that they are completely at rest when we perform this initial pressures test, because they are pressures at rest. Okay, so for our next step, we've got our patient laying flat, nice and comfortable with our cuffs on. We now need to connect our hoses. So our machine is great. It gives us color-coded boxes to kind of let us know which hoses go where, because there are several of them. We also have the option to do different things like a PVR or segmental pressures, which we'll be demonstrating the PVR portion here in a moment. But the segmental pressures, there's hoses involved for that. We're not going to do that on that test. We're going to focus more on our ankle brachial indice, our diagnostic ABI. So we're going to hook those up. But I just want to let you know, you'll see all these different hoses, but the machine makes it super easy for you and tells you. So by looking at the picture here on the machine, I know my solid red is going to go to my patient's right brachial, and my striped red is going to go to my patient's left brachial. All right, so using the new system, we're able to just take this in here and just rotate it on. How smooth is that? Really nice. So we're going to put that on and lock it in place. Now that is securely fastened with the hose. Let's go ahead and do the same thing on the left arm. So we're just going to take it and just slowly twist it on, and you can feel it gets nice and snug. So those are ready to go. Let's come down to our ankle and do those. Okay, so down here at the ankles now, we again look at our system. It tells us our yellow solid is going to go to our patient's right ankle cuff, and our striped is going to go to our patient's left ankle cuff. So again, our oversized lure lock here, we just take it, plug it in, nice one-handed, nice and connected. We do the same thing on the patient's left ankle and just twirl it on there. Okay, so we are going to start with our first brachial pressure, and we need to get our Doppler waveform to do that. So we're going to go ahead and place our probe a little bit laterally. Now you can do the radial, the ulnar, or the brachial artery. Doesn't really matter where you get this Doppler signal from. So rather than going up to the brachial, where unfortunately the artery likes to move around a lot, I'm going to come down and do the radial, kind of get a cleaner signal. So I'm going to start a little bit laterally on the patient's arm and just start to move into the signal. A little bit past the signal and then back into the signal. Now watch what happens if I have my probe placed completely perpendicularly on the vessel. I don't really get a great signal. But if I add just a little bit of an angulation, so I'm coming into the vessel as it's pulsating, and get a nice, clean, sharp signal. That's what we're looking for. So about a 45-degree angle on your probe placement here.
Now the system will auto-inflate once it detects 4 pulse signals. It's auto-inflating. Once the vessel occludes, auto-deflation starts. And then once the return flow detects 4 pulses, the system will auto-capture. Now we're going to conduct an ankle PVR, and we're going to inflate the cuffs to 65 millimeters of mercury. And the cuffs are inflating simultaneously. And now we'll bring the baseline down. And wherever you leave the waveforms, that's what will show on your report. And what you're seeing on the screen now is RAR, rapid amplitude reduction.
Okay, so the next thing we're going to locate is our DP artery on the left ankle. So we're going to come to the anterior foot, place our probe, remembering if we're too perpendicular, our signal's not going to be good. We're going to add that 45-degree angle, not pushing too hard, and get that nice sharp signal. There we go. So we'll record our Doppler waveform, and then we will inflate our cuff. Cuff is inflating. We're holding still. Notice how I'm using my index finger to stabilize myself. Now cuff is deflating, and we're waiting for those 4 strong beats to come back. Good, and we captured that. Now keep in mind, sometimes that first signal of return flow will be a reversed flow with your DP because it's being collateralized or pulled from that posterior tibial artery. It is up to your internal policies at your facility to determine if you can use that first return of flow or if you need to wait for the proper flow direction before recording your pressure. Okay, so we're moving on to the posterior tibial artery. I've got the probe placed on the patient's medial malleolus, just behind that ankle bone. We've got a nice strong signal. We're going to record that. Okay, now we're going to inflate our cuff. Again, notice I'm using my pinky finger to stabilize myself. Cuff is inflating. Good. Now it's beginning to deflate. Again, holding perfectly still, trying not to slide off of that vessel. Four normal beats, and then it'll record the pressure. Okay, so the next test that we're going to focus on is going to be our toe PPG and pressures. So I have some of my tools here that I'm going to use for this test. I do want to preface this by saying that your patient does need to be warm. They need to be relaxed. Their feet should have been kept warm for this because we want that normal circulation. We don't want the arteries all clenched down because the patient's foot is cold. A really great clinical utility for this test is if you have a diabetic patient with non-compressible vessels, so your ABI is less reliable. You can use this PPG in order to get that additional information as well as the pressure to get that additional information in that patient population. It's also a great indicator of overall wound healing. So let's begin with applying our toe cuffs. So I have 2 different cuffs here. Again, it's just like we did with the arms and the ankles. We've got our 2.5, so we kind of just put that up there. You can see that's a pretty good size overall. That should work well for that big toe. Versus if I look at my 1.9, a little bit smaller, you can see that's probably just going to be a little bit too small for that toe. On it, the width of the toe. So we're going to put this one aside, and we're going to use our 2.5s. So we come down here, again, cable, this inflator here tubing, doesn't matter where that's going to come out. You just want to make sure that you get a nice snug fit. So I'm going to come down on the base of the toe, wrap this around, snug fit, and bring it around to connect it, just like so. Then we can take our PPG clip. So our PPG unit is inside of here, and we're going to clip this onto the toe. This system allows for us to clip it on top of the toe, like so, or we can come off to the side of the toe, like so. But we do want to get it on that back side of that toe, and we don't want these green tongs here to be underneath this cuff. We don't want it disrupting that, so we want it to be either over it or just above it as we place that clip like this. Now, if we are in a high light situation, this PPG does rely on lack of light, so we want to place a towel just over the toe to hide some of that ambient light in our room to allow for the PPG to be as sensitive as possible. Okay, so for this protocol, my machine is set up to use this yellow cable, so I'm going to bring that from my ankle cuff down to my toe cuff, again, using my Lock system just to tighten it on there, very smooth. There we go. Okay, so here we see our toe waveform is coming up from the PPG, and we can adjust scale or gain as we need to allow for that to fully fill our screen, and we're going to record that waveform. Next, we're going to go to our pressure, and we're going to inflate our toe cuff. So here we're running our waveform. Inflation has begun. Drop out of signal. Wait for return. We can start to see a return of the waveforms, and we'll record there. So on our readout here, we can see that on our right toe, it picked up in the correct place. We can see the DC PPG represented by our magenta line is in line with where the beat is. However, if you look at left toe, you can see that the system detected it after that magenta line started to climb back up. So let's back this up a little bit so that it actually correlates with where that magenta line started to take off again, and that is where we'll record. Okay, so I have my PPG clip here. I did want to just quickly show you guys something. So putting it on the toe, yep, great, but you also can pop out this PPG. So I'm just going to open the clip, push from the back. That's going to allow me to remove the PPG sensor and bring it through the clip, put that aside. What I can do now is use some double-sided tape if I'm trying to work on a smaller toe, and I can just tape it to the toe. Or if I have an amputee patient and I'm looking for limb perfusion at the stump, I can place it on the stump with my double-sided tape. So it's very versatile. Okay, so we have completed all of our necessary measurements for our exam. So now let's look at our reporting feature. So what we're going to do in the system is we're going to hit the summary button. That is going to bring us to a summary of our findings. If we come to print report, we can see a preview of what our report will look like. Okay, we can hit next page. First page is our information. Let's go ahead and zoom in a little bit. We can see our patient information. We can also zoom back out. We'll go to next page. Here we have all of our pressure information and our signals. And then on our third page, we can see those toe pressures and signals that we obtained, which you also can integrate into the previous page. We can also export to a PDF by clicking this button here. Let's go ahead and close, come back to this main page, and at the bottom here, for full integration, we can hit our send to PACS.
All of our systems provide seamless Wi-Fi integration, enabling real-time report generation and direct transmission to your PACS or EMR. And similar to your ultrasound machines, we also provide DICOM SR to auto-populate your structured report templates.
All right, within the summary, we also can edit some of our Doppler information. And as someone who teaches other technologists and staff members how to perform this type of testing, I do like to be able to go back and review their images. Here I'm able to see that as they were performing this pressure assessment, they allowed for, as we're sweeping across here, they allowed for at least at a 20 sweep speed, they allowed for at least 4 hashtags. So I know that they allowed for that cuff to inflate at least 20 millimeters above mercury of where cessation of pulse occurred, which is what we're looking for when we're performing an adequate test. So, and we also have a lot of editing capabilities that we can build into our reports to make sure that our reports reflect all of the diagnostic information that both the interpreter and the requesting physician will need, as well as for our billing purposes. All right, another thing we can do is if you come back here, you notice how I have a beautiful triphasic waveform here in my signal, but I had already recorded a Doppler waveform. If I decide that I like that better, what I can do is come up to my sweep speed, I can change it to a 4-second sweep speed, which allows me to really get in and see the detail of that Doppler signal, and I can capture and record this by going to Save Doppler in order to add that to my report, choosing which vessel I'm trying to replace it with. Also, in our editing of our final report, we may want to go back and look again in teaching situation, or just when you're performing the exam, you want to make sure things were done adequately. We can look here and we can see the timing of our rhythm. And we're wondering, you know, in those diseased patients, is that first initial pulse really a real pulse? Well, I can tell from the timing of my rhythm on left side of screen here, and then compare that to my rhythm on the right side of the screen here, that yeah, that truly does match up. So that is my real first pulse, and I can adjust where my machine is recording that first pulse for that pressure if needed. All right, and that'll do it for us today. I want to thank Image Monitoring USA for their continued support of our educational programs here at Gulf Coast Ultrasound Institute, and I want to thank them sincerely for inviting me to be part of this great demonstration today. As you can see, physiological testing is a great adjunct to your clinic, and it allows for you to really evaluate disease in a way you never have before. I invite you to ask more questions and seek more answers, and as always, we're always here to support you in any way we can. Have a great day.
Thank you for watching the video. Hopefully you learned something from it. Gulf Coast Institute is fantastic educators, and we appreciate their opportunity to work with them in various capacities throughout the years and decades, and also the time that Tricia took to film this. We truly appreciate that and all of her expertise. The Falcon system is a truly fantastic system, whether you're looking at the Falcon Pro, the Falcon Express. They're both fantastic. And we also have the Dolphin TCD series of systems. We have a wide variety of Dolphins as well, and a wide variety of packages. So we can fit every form factor and meet every need, whether it be physiologic or Doppler TCD. We're here for you. We'd love to take care of your needs. Please give us a call or look us up online. Have a great day.